It's my pleasure to move forward now with our next speaker, who comes to us from Canada. Dr. Keith Gordon is not only a member of the AMDAI board, an important member of our executive committee, but he is also the Vice President of Research at the Canadian National Institute for the Blind. And it is my pleasure to introduce Dr. Gordon, who will be speaking to us about an overview of wet and dry AMD. Keith? And I may need to interrupt you for our member of parliament. So.
Okay. What's a tweet? Okay. Okay. Thank you very much, Mark, and thank you to everybody here for giving me this opportunity to give you a little bit, tell you a little bit about what AMD is, and to fill you in on a study that the AMD Alliance has conducted comparing the state of AMD in the UK with 5 other developed countries. First of all, let's start off and just tell you in very, very broad terms what AMD is. Dr. Alan Crewis is going to give you more of the medical background. AMD is a progressive disease of the retina that results in a loss of central vision. Generally, AMD does not lead to a total loss of vision. The central vision goes, but very often the peripheral vision is still in fairly good shape. As the name implies, AMD stands for age-related macular degeneration. It is a disease that generally occurs in older people, people over the 50. It is a major cause of blindness and visual impairments worldwide. And in developed countries, generally about half the population lose vision as a result of AMD. Half of the people who lose vision lose it as a result of AMD. Globally, AMD is responsible for about 10% of world blindness. There are 2 forms of AMD, most easily remembered as the wet form and the dry form. The dry AMD is responsible for about 80% of AMD, but about 90% of vision loss is due to the wet form. So when one develops the wet form, you can lose vision very soon after developing the wet form. The good news is that there is treatment for the wet form, and unfortunately we don't yet have good treatments for the dry form. I'll leave it to Alan to talk about that in more detail. I just wanted briefly to put AMD in the perspective of what it means to the individual who loses vision. And here are a few statistics on what vision loss means at a personal and social level. We did a study in Canada that showed that about 1/3 of working-age people with vision loss are employed. That's 1/3 are employed. More than 2/3 are not employed. About half of people with vision loss earn less than 20,000 Canadian dollars a year. That's about 10,000 pounds. Just imagine what it's like to have to live on 10,000 pounds a year. Older adults with vision loss have twice the risk of sustaining a serious fall, triple the risk of clinical depression, quadruple the risk of hip fracture. They're 3 times as likely to be admitted to nursing homes or long-term care facilities, and they generally are admitted to long-term care facilities about 3 years earlier on average than sighted people. And finally, they have a great feeling of loss of independence, and the first major milestone in that regard is when they lose their driver's licenses. So let's talk about the study that AMD Alliance did. The goal was to compare the landscape of AMD with that of other Western countries in terms of prevalence, the prevalence of AMD, the cost of AMD, and the management of AMD. While the study was directed by Dr. Crewis and myself, it was conducted by Deloitte Access Economics, who are an organization based in Australia that have done studies of this sort elsewhere. We looked at the people who had late-stage AMD only. That's people who are already losing vision as a result of AMD, So the prevalence data is a little bit different from some data that you may see quoted in the literature, which looks at all forms of AMD. And we looked at people aged 50 years or older. For data sources, we looked at published literature, we looked at online data, we consulted with a bunch of experts, and in general we tried to look at data sources that were common for all the countries that we were studying in order to make comparisons possible. In each country, we contacted 5 key informants. These were people who might have been AMD Alliance members. We spoke to leading scientists with expertise in AMD, and we spoke to national government health authorities. So here are the results. This is a very complex chart, and I know for people with vision loss, it's not that easy to see. But those that are sighted, I'll speak to the data, but those who are sighted, you can look at the 2 columns on the right. They show the per capita prevalence of AMD in 6 countries. And this is per capita for people over the age of 50. In the United Kingdom, about 14 people per 1,000 have wet AMD. In the United States, it's about 15, Canada 11, Australia 16. In France, it's a little bit higher, it's about 18, and in Germany, it's about 11. So the range goes from 11 to 18 people per 1,000 have wet AMD in the population over 50. So that's fairly tight. In dry AMD, the spectrum is a little bit wider. In the United Kingdom, about 14 people per capita, per 1,000 per capita have dry AMD. In the United States, it's about 12. In Canada, it's as low as 5.7. Germany is 5.6. Australia is 8.9. And France is 8.8. So it ranges from 5 to 15. So it's a much wider range. And I don't really know what the difference for this is, but those are the reported data. If you look at the prevalence of blindness by country, for people over the age of 50 again, it's almost identical. In the United Kingdom, it's about 10.7 per 1,000. In all the other countries, it's about 10, except in France, it's 18.8. And I don't know why France is higher. Just reporting the data, not giving reasons for it. And in pretty well all countries, all of these 6 countries, all of which are Western countries, all of which have more or less similar Caucasian populations, blindness due to AMD is about half of all blindness. We looked at the burden of AMD by country. The burden of AMD is often called the cost of suffering, and this is a measure that uses a metric called DALYs, or disability adjusted life years, which measure the healthy years of life lost due to disability as a result of AMD. It's a little bit complex, but what it in fact enables people is to measure the impact that AMD has on individuals' lives. It's not really a financial measure, but it measures the impact that it has on people's lives by country, and enables comparison across diseases and across other countries. We found a fairly wide range of burden. In the United Kingdom was the lowest, it was about 2.5, and France was the highest at 7.4. Again, not clear what this means. We need to go and dig into these numbers a little bit more. Moving on from the data and the real numbers, we looked at the drugs that were registered for AMD in these 6 countries, and it was pretty well identical. The most common drugs for wet AMD are Lucentis and Eylea, and Avastin, which is a drug that's used off-label for the treatment of wet AMD, was not registered in any of these 6 countries. However, when one looks at the drugs that are funded by government, we found that Lucentis was funded in all countries. Eylea is funded in all countries now except Germany, which is I'm sure it will come online soon. But Avastin, in spite of the fact that it's not approved in any country for the use in treatment of AMD, is in fact funded for AMD by Medicare and Medicaid in the US and by 2 provinces in Canada. We looked at the pharmaceutical costs of AMD by country. In US dollars, we found that in England, the cost per capita of people over 50 of pharmaceuticals only was about $12.50, and in the US was $15, and all other countries were over $20. And I think the UK and US numbers have to do with the fact that we're probably not getting all of the private sector funds. In the UK, we were looking at the National Health Service hospitals only. So it's costing about $20 per capita of people over the age of 50. One of the most important things that people with that the general population can do to make sure that AMD is diagnosed in its earliest stages is to have regular eye exams. So we went and looked at these 6 countries to see how often people over the age of 60 were getting their eyes examined, and we found that it was fairly consistent across all countries in that about half the population was getting an annual eye exam when they were over the age of 60. Once one loses sight, the next most important thing that one can do after treatment is to undergo vision rehabilitation, and we wanted to know whether people were being referred in these countries for vision rehabilitation. And to the extent we were able to get these numbers, 3 of the countries showed that about 3/4 of the population were being referred for vision rehabilitation. In Canada, it was, from the one study we looked at, it was just about half. Heads are shaking over here. They don't believe it, but that's the data that we came up with. Okay, so how does one prevent AMD? We've talked about some of the impact of the disease and how many people have it. The first thing one can do is have regular, complete eye exams. It doesn't prevent it, but it enables it to be diagnosed at an early stage. Good nutrition, as in so many other diseases, plays an important role in the pathogenesis of AMD. One needs to eat dark green leafy vegetables like your mom told you to, kale, spinach, things of that sort. And omega-3 fatty acids have been shown to be helpful in the prevention of AMD. Sun protection, when we talk sun protection in Canada, people think that we only talk about the summer because, gee, nobody really goes out in the winter in Canada, but people do. And when you're out in the snow, you don't have much snow here, but when you're out in the winter, you should be wearing sunglasses that offer UV absorbing capacity. Weight reduction is good in the prevention of AMD. And one of the most important things somebody can do to prevent AMD is to stop smoking. People who smoke are 3 to 4 times as likely to develop AMD as people who don't smoke. And if you quit smoking within a relatively short time, your risk returns to that of a non-smoker. Cigarette packages in Canada now carry the warning that smoking causes blindness. And as if cancer wasn't enough, we were hoping that blindness might have an effect.
1 more minute.
1 more minute. I'll do it. As I mentioned, once one has vision loss, the next most important thing you can do after treatment is to undergo vision rehabilitation through an organization such as Leslie's, the RNIB, or ours, the Canadian National Institute for the Blind, where we provide strategies for coping with vision loss. We'll teach people how to use magnifying devices. We teach them how to use the remaining part of their retina that is not affected by macular disease. That's called eccentric viewing training. We teach people how to get around in their homes and out in the real world. and we teach them how to use computers and assistive devices. So we help people, in a word, regain their independence. And finally, as you mentioned, Mark, awareness is the key to the prevention and management of AMD. And that's why we're here today, to try and increase awareness of the disease and the need for early diagnosis and treatment. We hope you'll help us on this journey. It's a long one, but we hope that we'll be able to make some impact through events such as this. Thanks very much.